Patients should be seated for at least 5 minutes in a chair with back support, rather than on an examination table, with their feet on the floor and their arms supported at heart level. Patients should also refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. Blood pressure measurements must be taken on a bare arm. Next, you must find the brachial artery in order to find the pulse. The appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm, and this is found by using the markings inside of the blood pressure cuff. When using a stethoscope, it is important to make sure that it is pointing away from you. Make sure the stethoscope is turned on, and once it is turned on, make sure that you place the blood pressure cuff on the patient. Now place the stethoscope chest piece below the antecubital space over the brachial artery and make sure that the chest piece is not touching the blood pressure cuff. This could cause inaccurate readings. Quickly inflate cuff pressure to 20 millimeters of mercury above the first corticoff sound. If you do not know where the first corticoff sound is, it is safe to inflate the cuff to between 180 and 200 millimeters of mercury. Now release the pressure at a rate of 2 to 5 millimeters of mercury per second. Systolic blood pressure is the point at which the first of 2 or more corticoff sounds is heard. The diastolic blood pressure is the point before the disappearance of the corticoff sounds. At least 2 measurements should be made, a minimum of 1 minute apart each, and the average of the 2 should be taken. Blood pressure should be measured in both arms during the first examination. Higher pressure should be used when there is a consistent inner-arm difference. It is important to provide patients verbally and in writing their specific blood pressure numbers and blood pressure goals. Normal tensive blood pressure is classified as less than 120 for systolic and less than 80 for diastolic. Prehypertensive systolic blood pressure is between 120 and 139, and diastolic prehypertensive blood pressure is between 80 and 89. High blood pressure or hypertension stage 1 is classified through systolic pressure between 140 and 159 and 90 to 99 for diastolic. High blood pressure hypertension stage 2 is 160 or higher for systolic or 100 or higher for diastolic. Hypertensive crisis, in other words, emergency care is needed, is higher than 180 for systolic and higher than 110 for diastolic. When blood pressure is above normal and considered prehypertensive or hypertensive, a lifestyle change is recommended.